Hi guys, how are you? Okay, today is more a conversation a casual. My name is Dr. Pry. I'm the CEO of International Health Alliance. I think this is the best thing that I ever choose to do with my life to serve others. And the goal today is you have questions answer and it's interactive. It's casual, it's not very strict. We just want you to know the experience of one of our former students, and later you can see the recording online too. But right now, we're gonna move on and go with our COO, Dr. Salvador Colmenares.
Hello, everyone, and welcome to this live Q&A. My name is Dr. Salvador Colmenares. As Dr. Pride told you, I'm the COO of the company, and I'm glad to have you here today. So we will start with this Q&A by first talking a little bit about IHA. So basically, the mission and vision of IHA is to break down barriers in healthcare, but also foster a network of healthcare professionals in order to do this goal, right? And work as a team. And currently we have different programs. We have the Global Health, Public Health and Medicine program. We have a Global Health and Research program, and we have a newest one that is the Clinical Research and Data Analysis. At the same time, we are very proud to foster a community of healthcare professionals. And one live example is our former intern, Carina Rocha. She's with us today. And basically, this is the community and the connections that we make with all of the former students, and that's the community that we create as healthcare providers, right? And here today we will talk about Karina's. We'll talk about her experience in the Global Health, Public Health and Medicine program. But also, if you have interest in the other programs, you can do your questions on the live section right at the end, and we will be happy to answer them. So basically, all of these programs are focused on like bringing healthcare, right? But specifically, the we have the global health, public health, and medicine that is the more hands-on uh, focus on, right? Then we have the global health research that is focused on that clinical experience, but also gathering a research component in which you act in the design of your research, but also get involved on the data collection and the data analysis. And last one, we have our newest, that's the clinical research and data analysis, in which you participate remotely without traveling in all of the aspects of the research. And we are very happy regarding the results, because these results gets changes. Like we get to identify challenges within the public health issues, and we address them by doing this research. So now I'm going to pass the mic to our star of the day, Carina Rocha.
Thank you so much, Dr. Salvador. I wanted to preface that I am the team leader of the August 2025 cohort where I interned in the Global Health Public Health Medicine internship. And if you can go to the next slide. A little bit about me is that I am a first generation student majoring in neurobiology at the University of California, San Diego. And I came from a low income background, not having many resources in the beginning. And so a lot of what we did to change that, or what my parents did, was that they did a lot of medicinal remedies with teas and herbs, just to bridge that gap between medicine and patient. And while entering at UC San Diego, I was exposed to a bunch of different opportunities, including network, internships, organizations, and a lot of nonprofits. But one that really stuck out to me was research. And as you can see in the middle, that was my first job in the Cherokee Lab doing research in neurodegenerate diseases. And while I love doing research, I felt as if I was only in the background of medicine, not making any physical changes in the realm of health. So it wasn't until a very tragic event happened in one of my family, or in my family, that my father underwent a stroke. And because of that, I had to drop school. I had to take a week off of work. I had to leave behind a lot of responsibilities I had at school to come and be present with my father. And so during this time, I realized that it is essential to be present in the moment and to have active care. And I know that without a doubt, my presence there augmented my father's recovery so much so that he is now well and doing great. But because of this experience, it made me realize how much I want to be in um, I want to be hands-on and I want to be present within the patient's lives to make an impactful difference. And if you can move to the next slide, I talk a little bit more about the internship because I know a lot of you guys might have some questions on like, what do I do, or how does this internship work? This internship is very hands-on, very cultural immersion. You get to see a lot of how these patients live. And you also get to do a lot of hands-on vitals, technical skills. And so um, coming from San Diego, I have done a lot of mobile clinics near in Tijuana. And so the major difference between this internship and the internship that I've done in TJ is that in the IHA internship, they do a lot more hands-on activities. They teach you how to do manual blood pressure. They teach you how to take respiratory counts, how to take glucose levels. And all these are vital skills in the medical field. In my organization for TJ, they teach you how to do a lot of documentation, but they don't really give you hands-on because you need training, you need experience, and you need how to do it effectively. And so this is what IHA does completely differently, is that they put you in a very immersed environment um, where you're exposed into these scenarios and you get to apply your skills that you learn in real time. And so in a couple of these pictures, there is just on the far left, there's a picture of how we take our respiratory counts and how we do manual blood pressure. And in the middle is our lobby where all the patients get seen. And to the far left, we do a medical flyer presentation to the patients. And so this is just to bring awareness to the different infectious diseases there are in the Dominica that patients may not be aware of or maybe know that they have it. So this is a perfect opportunity to get more involved in these rural communities because a lot of these communities are unable to see a doctor because of transportation issues, financial issues, or just merely because they're too sick to go and see a doctor. So um, yeah, this is a perfect opportunity. And if you go to the next slide, um, we talk some of my favorite moments in the internship was just merely getting to see the patients. In this first picture on the far left, my cohort did two donations. We did a toy drive and we did a hygiene kit um, drive as well. And so being able to give children toys was very heartwarming, and it brings joy knowing that maybe these kids have never even played with a toy or have even seen a stuffed animal before. So to show that just to bring a little bit of happiness into their lives really makes a difference in your own life as well. And for the hygiene kits, um, we were able to donate feminine hygiene products. We were able to donate sanitation wipes, contraceptives, and basic toothpaste and toothbrush essentials. A lot of these patients don't have access to these materials. So it was amazing to be able to provide these patients for just basic necessities without a cost behind it. And on the far right, I do want to talk about how the hospital went because the my experience in the hospital was phenomenal. We got to see a lot of newborns. We got to see a lot of surgeries. We saw the pediatric section, and that was completely different than when you see here in the States. The fact that in the hospitals there's usually a ton of patients. There's not many hospitals around anyway, so the fact that that hospital is probably the only one in a 50-mile radius is is important. A lot of people don't have access to these resources. So being able to see, and one of my cohort members, Tristany, was able to hold a baby. And I think that was amazing to even be able to do that. So that experience was amazing. And also another important bonus is that they provide amazing food, and this is breakfast, lunch, and dinner. And this is what this plate in the middle is called la bandera, and with this just plantains and protein and sauce and lettuce, and it is amazing. So the food there, they do not skimp out on your food. They provide really good, high quality meals. So, but overall, this experience was really life-changing for me as an intern because this really directs you into your path if you want to go into medicine. If you don't want to go into medicine, this is a great stepping stone to get exposure to different medical fields. And not only that, they have different programs where you can try and see what best suits you. And a little piece of advice from intern to other prospecting interns is that you get as much, you take out as much as you put in. So if you're merely not really connecting with the patients, you're not talking to them, you're not interacting with them, you're not gonna get the full experience. You need to put in as much effort as you can in order to feel that fulfillment and make a difference in these patients' lives. These patients want to talk to you. These patients want to meet you. And even though you may not um, be fully comfortable in speaking in Spanish or in different languages, there are opportunities for you to connect with them through interpreters or other forms as well. But yeah, so that is my experience as the team leader of the August cohort, and I can pass it on to Dr. Salvador.
Perfect. So now we will go to the submitted questions and we will answer it. But in the meantime, if you have any questions so far, you can put it on the chat and we will answer after this section, okay? So let's go to this section and we will answer it. First, how do you explain or phrase your experience with us in your resume, in interviews or in networking?
Yeah, so I know that this is very probably difficult to talk about and to experience because it is a hybrid type of internship. But what you can emphasize is your hands-on experience that you do during your time in the Dominica. And so here I put in two examples on how you can showcase your skills in a resume or in a LinkedIn. I merely just put this section in a volunteer experience section where you can talk about you being an intern, talk about foundational clinical skills you learned, talk about how you learned how to do data entry, documentation, and do vital signs measurements. Those are very important. Especially in the medical field, you get to do those a lot. And shadowing medical professionals, designing, in the internship, you will be designing, like I mentioned, a flyer for the patients. That is important as well because it showcases proactiveness, you being aware, and just being a leader in for these patients. That's very vital. And also using medical Spanish. The doctors there teach you a lot of their medical terminology. You get exposed to how to diagnose patients. You're exposed to how they treat these patients. So being in the same room, that is important because it teaches you how the doctors work and how they help out these patients in their ways. On the left, I kind of put in how you can put this experience on a LinkedIn. You put your same skills, but then you can add actual skills in the LinkedIn tab. And more importantly, at the end of the internship, the International Health Alliance provides you a certification. And I recommend putting an image of that certification to showcase that you've completed this training, and you now have all these experiences that you gain throughout this internship to be a competitive applicant in the job market. So um, that's kind of how I would break down the the skills that you learn in this internship. And yeah.
Something else that I want to share is I love how to receive like messages from and emails after the internship happens of the students, the interns, because some of them is like, thank you for the letter recommendation. I just entered to my PhD program or MPH program. And one that I never gonna forget is this was like 3 years ago. One of the students was very upset because I was telling him that he needs to learn how to take blood pressure manually. And I remember how he texted me, hey, Dr. Pry, I just want to let you know that I just got my interview for med school. And when I talk about my internship, they ask me what I learned. And I just talk about how I learned how to take blood pressure manually, and they even want me to explain everything, and I think that's the shot that I gonna go in med school. And he emailed me months later that he just got to med school. And it's very interesting to see like what something that some people see so simple, like learning how to take blood pressure manually, is gonna take in like a skill that can be used in his lifetime. And I think that's very good things to put how Karina is playing in their resume or interviews or networking.
So tell us about how do you typically spend your time after the clinical hours?
Yeah, so after the clinical hours, we are in the city of Punta Cana, and Punta Cana is a huge area for tourists. So there's a lot of things to do in Punta Cana. The beach is like a 5 minute walk right from the hotel. You get to explore a lot of shops. There's a lot of restaurants nearby. A lot of the time when we would be done with our mobile clinics, we would go out and eat food, or we would go out and try different activities. I know that there are a lot of little mini shops that you can walk into. There's a big mall. I forgot the name of the mall, but there's a big mall that you can go into, and it's a very beautiful place to be. Punta Cana is very beautiful. And I remember one of the core memories that I would do is that sometimes we would, in the form of transportation, that we would do Ubers. So we would Uber everywhere. And they're typically really, really fast. And that takes you to the malls, that takes you to different restaurants. And there is a lot of excursions that you can do in Punta Cana. And so I know one of the excursions available was like horseback riding. A lot of the one that we did, my cohort, we did boogie riding, and that was so much fun. That was amazing. We also went to Catalina Island, I believe so. That was also so much fun. You get to ride on a speedboat. You get to go climbing on you get to travel a lot. There's like a lot of sightseeing. The views were amazing. The water was crystal clear, like beautifully blue. It was so amazing. Um, there's just so many things to do in Punta Cana that you kind of you don't get tired of it. So yeah, I would definitely go back and explore more of Punta Cana.
I just want to be clear something. Yes, they use Uber, but it's for our fun activities. We have our own transportation for the clinics. That is apart. When you go out, for the fun activities that is not part of the internship, that's another transportation that you guys choose. Just want to be clear with that. Next one, Dr. Salvador. Thank you.
So
Uh,
now this,
okay, I can answer this. What are the travel details regarding airport arrival and required attire? But the airport arrival, we're gonna send you specifics about where you're gonna be landing, specific hours, because we're gonna have a bus waiting for you. We're gonna have a teammate waiting for you. Our amazing airport of Punta Cana is the main one that we're gonna use. Even have a pool if you wanna use it later, but when you are going back home. But that's the airport. Attire you're gonna use in the week is scrubs and closed shoes, how you see in the photo. And the good thing that we want to share is when you are in the country, when you're landing there in the arrival, we're gonna send you a care package. That care package is gonna have the shirt that you're gonna be using to get in the bus. If you don't have that shirt, it's part of our security measure. You're not gonna be able to go in. Or we're gonna have to check passport and a lot of information. But we're very intentional with who's going to our bus and what we're doing there. But this is the airport. Did I missing some part of the question?
no, the attire, like we use
Okay.
scrubs and we use, like, as you see in the photo, you can bring any color that you like to. Like we don't have any specific color to use.
Yes.
This is very important. I don't speak Spanish. Can I still provide for the patients? Yes. Wait. So yes, basically in every station you will have first translators, and also all the doctors are skilled to talk in English and Spanish. So they will translate all to you and make your experience like fully complete in terms that you get to understand all of the process, all of the questions that the patient may ask, all of the like the prescriptions, all that, the information that we also provide to the patient, like how to take the medicines, everything. You will be 100% in the in that space, and we have translators, as I say, in every stations.
I can answer that question. What benefits does HI provide? If you're going to a research program, I can be very proud to say it. We even participate. Dr. Henry Mergar is amazing professor. The team can tell you every person that have been with them, and we see opportunities where you guys can publish the material, the product that you're gonna do in research, and we present. We went. That was in the DR. Cochrane is one of the biggest research. If you guys can research for that, and we present two of the research. They choose. We submit two research that we did in our clinics, was created from the research question for our students, for our interns, and we submit two of them. Two of them was the two of them we just submit two, and the two of them was accepted to present a poster, and one of them won. One of the poster won, and that was very proud to say that our students, our interns, are making impact, and not just that like that, we are working with the public health department of the country, and they have all these results, and we are doing a change. That means you do a full cycle research experience. You're gonna have a, for sure, how is Karina explained, you're gonna have a clinical exposure in real patients setting. You're gonna pre-program training. That means even the intake form that you guys gonna be talking about and talking and asking to the patient, because we train you, we send you a video how to pronounce in Spanish or in English, how to pronounce every detail. We send you that information. We provide for you. That way you are able to be ready. You are not like anxious. What is going to happen? No, that's why we have our weeks of training, that you feel comfortable, that you are prepared. We believe in here that preparation is part of success. You're going to have training on leadership. That was, I love how Karina explained, like leadership in the hospital. It's very important to explain. Sometimes like something very simple in hygiene, patients doesn't know it, and we can be leaders and explain it to them. You're gonna be a strong position. How Karina said, and something that you can share in networking was like she said when she went to Tijuana, she do a lot of paperwork, but doesn't have a hands-on, and that's something that you can share in your networking. And you're gonna be 100%. Sometimes in our teams, we have even more doctors than students. That's a fun fact that you're gonna be directly to mentorship from healthcare professionals, and all of us are licenses. All of us are working in the environment. And I think the global health exposure, public health exposure in another country, I think that's a win. Did you see the reality? Not just in clinics that we're creating by our team, is even the opportunity to go out to a hospital and see the difference in another country. How Karina even mentioned, it's not the same thing to go to a pediatrician guard in the States to go to a pediatrician guard in our country, in my country. If I haven't expressed it before, but I'm Dominican. And that's why I create this, because I think win-win situation. Our patients receive care, and you guys have the amazing experience of learning and a cultural experience. And I think those are the main thing, like making a real impact in another society culture. I think, and you are being exposed to that, is the main gain that you ever can have as experience.
Another benefit of IHA is that we have our own journal and also we have a blog. So we are more like we welcome you once you're part of it to post where if you do research, maybe in your university or you want to share something you want to publish in a journal, we are more glad to have you. And those are the kind of benefits that we offer, and we are going towards that path of research, but also like the research that we do is with the goal of assess necessities within public health, right? But we also are open to receive research that you do in your countries, within your field. Like we are like open in that sense. Dr. Pride. So what is required of the students once they are accepted to the program?
When they are accepted to the program, they're gonna receive an email, and in that email, we're gonna send the information that you guys are going to choose the week that you guys gonna go. We explain all those things in your interview. The answer of your when you're accepted is come like a week later or 24 to 72 hours, depend the quantity of applicants we have in that week that we're interviewing. We have 7 people interviewing our participants. We have hundreds of applicants, but I just want to be sure that you guys know our research team doesn't get more than 5 people, our interns in our research cohorts. And in our teams of medical or public health or global health doesn't take more than 18 to 22. And that's dependent cohorts. Sometimes, lately, dependent community we're going, we're choosing smaller cohorts. Why? It's not quantity for us, it's quality of care. And yes, I'm very, in a way, very jealous with the care that I go to the country. It's, I know it's my country, but at the same time, I want to provide the best care. We are doing this because of passion. We are not doing this for quantity. After you get accepted, you're gonna receive an agreement with us. You're gonna put your information when you want to travel, and the way of you are assigning for the payment of your choosing to pay your internship. And I think that's all for that.
Perfect. So now we go to the open floor live questions. To the live participants here, if you have any questions, you can open your mic and you can just share it on the chat. don't feel pressure. You can share your questions. We will give you a few minutes, okay? But overall, if you have any questions about what we have discussed, or you want to reassure any information, this is the time.
If we don't have any other question, we're grateful that you guys are here. Hopefully we see you in the team if you in your interviews to see how everything goes. And we have a good news to share today. Can you do the next slide? Is if you have questions and you feel a little bit don't want to be public or text, we have a WhatsApp account. That means that you're gonna have an interactive conversation, and the majority of that answer is gonna come from me. That means that I'm the best person to answer any question. We would love to you to text us, ask any question. We'd love to answer. And don't think that like some question is too small. I think all of them have a purpose. And I think after saying that, if I'm not missing anything, Dr. Salvador, I think that we are ready. Thank you for being here, and I really appreciate your time and hope to see you in the interviews.
That's right. Thank you for being part of this session.
Thank you.
Always.
Always.